Hello, the topic today we're going to discuss is about burping. Burping is actually a normal physiological phenomenon that can happen to everyone, that happens with everyone after the digestion. It could be because of a normal digestive process, but it can also be a pathological one. So now we have seen, this is a foot pipe, then we have a stomach, then this junction has a sphincter that's called lower esophageal sphincter. When that becomes loose or it opens up, the gas in the stomach comes out easily. So over distended stomach with gas, when the sphincter is very loose, it comes through the foot pipe through the mouth. That's called burping. It can come with some sound. It can be combined with belching also. Belching is nothing but some fluids also, acid also comes out. So it could be individual phenomenon, or it could be combined with belching also. This could be a normal physiological phenomenon that can happen after any digestion, or it could be pathological one. So normally in a day, at least 6 to 10 times someone can burp. But if it's really disturbing, or it's really causing trouble, or it's prolonged one, or if you make a lot of noise, then it could be a pathological one. Then we should look for the reasons. It could be the smokers. When they smoke, they always have a burping, because when they smoke, when they inhale the smoke, it not only goes to the lung, it also goes to the stomach and aerophagia, and it can come out. So this is one part. Or suppose you have a carbonated drinks like soda, Pepsi, Coke. These can cause a lot of gases release that can come out as a burp. And certain people have that habit of drinking water when they eat. So they have a solid food with a lot of water. It can cause burping. And some people have the habit of after taking food, they voluntarily do that. They're habituated to do that. This is one part. And it could be a sign of a psychiatric problem. So psychiatric people, they voluntarily or without their knowledge, or maybe they forcibly do this kind of thing. It could be a psychiatric issue. Or it could be because of, most of the time, it could be because of the food what we take. Usually we say anything that grows below the ground level, they produce a lot of gas after the digestion. So this can come out as a burp. Or usually cabbage, broccoli, cauliflower, these produce a lot of gas, and even they can cause gas colic kind of thing. So, and not only that, peas, lentils, all these things produce a lot of gas. They can cause burping. And certain medications, especially diabetic medicines, that's called acarbose, that can cause produce a lot of burping. Or laxatives for constipation, certain laxatives like lactose, they can produce a lot of gas and they can produce burping. It could be a sign of ulcer. So anything from mouth to anus, if there is an issue or if a problem, it can come as a burp. Suppose somebody has a gallstone, even after the previous videos we were told, it could be a sign of gallstone disease. So they have always burping. And suppose they have undergone a previous open surgeries for cesarean or some laparotomy, so intestine, they all get jammed. So the gas cannot go down. Instead of that, it can easily escape this way, causing burping, the bloated abdomen, and then burp. So burping is not, it could be a simple and natural physiological one, or it could be a pathological one. If it's prolonged, or if it's very disturbing, or if it's very noisy, definitely you have to see the doctor. The basic minimum, again, the investigation is a clinical examination with endoscopy. Then they may ask for certain tests to find out what could be the reason. So burping, as long as it's you feel okay, it's fine. But if you feel, if somebody says, people usually they say, my son, he burps a lot, my husband is burping a lot, then it becomes significant, and probably you may seek a medical advice. Thank you.